Hello, my name is Natalie Jordan-Nixon, and I'm going to be presenting my clinical case on today, and I'm going to be talking about LC. Elsie is a 32-year-old female who is an archaeologist, a treasure hunter. She doesn't know much history about her parents, except that the maternal did suffer with the rheumatoid arthritis and that both of them were aristocrats. So, our 32-year-old female Elsie, she's presenting with a history of Crohn's disease. She also has iliac resection, hyperthyroidism. She has vitamin B12 deficiency, chronic pain, and she suffers from insomnia or trouble sleeping. She's also has a history of some worsening abdominal pain or abdominal distension. She has a history of epigastric pain, nausea, vomiting, and poor appetite. There was even some unplanned weight loss that she's experienced. She lost about 16 pounds in the last 3 months, which does show concern for us. A couple days ago, she started experiencing some new symptoms. She had a fever, she had cough, diarrhea, headaches, night sweats, and even experienced a rash on her lower extremities. And what I want to tell you about today is about the organs that were affected by what she's going through right now. The first organ that I want to make mention of is the small intestine, which was very severely affected. She had a small bowel obstruction from the Ascaris roundworms, bowel ischemia, which was basically a loss of blood supply, necrosis of the proximal jejunum, the inflammation. She had some thickening going on there, and she does suffer from prior Crohn's disease. And of course, malabsorption and the short bowel syndrome, because that becomes a risk after surgery. Also, the stomach was affected as well. As you can see on the screen here, I have both the stomach and the intestines there. The stomach was affected with the gastric dilation, bowel obstruction. She's also suffering with nausea and vomiting, and she needed a nasogastric tube decompression. So those are some of the things that were affected by the small intestine and the stomach. And as you can see on our screen too, the next thing that was affected was the lungs. The lungs were affected because she had some pulmonary edema, respiratory failure going on, which that was resulting from the intubation. She had to get some mechanical ventilation going on because her lungs were affected. And then we had the blood and the circulatory system that was impacted as well, and she did get a DIC, hematoma, hypotension. So all that was going on with her as well as before we get to the PS statement or PES statement, there are a couple other systems that were affected as well. The skin, because again, as I said previously, she had a rash in her lower extremities. The immune system, because she had a severe infection and she had some inflammation that was going on. If you look at the labs, the white blood cell counts were off. The C-reactive protein, the alkaline phosphatase for the liver, that was off. It was elevated. There was some inflammatory responses going on. The kidneys were affected. The bun level was off. So she had a lot of things going on with her. The endocrine system was affected, muscular skeletal system was affected because of the lack of nutrition. She basically was weak and was protein calorie malnutrition. And so she had a reduction in her strength, and she had functional decline. So all these things were affected. And then the nervous system was affected because she had headaches when she came in. She had chronic pain. So that was affected. Okay. So I want to talk about the how I would write a script for her. So our patient LC, her height is 175 centimeters. Her current weight right now is 53.6 kilograms. Her BMI is 17.4 kilograms. So the diagnosis is, of course, severe protein calorie malnutrition because she's not able to absorb what she needs to absorb. She has short bowel syndrome. She has a history of Crohn's disease, small bowel obstruction, secondary sclerosis status post total duodenectomy for her. And she has a stage 3 pressure injury, DIC, pulmonary complications, and she's basically just very, very critically ill and she's in recovery. So what I'm suggesting for her nutritional needs is the fact that she needs energy. She needs energy because she's so malnourished and she's post-operative, and I would say she's very critically ill, and she needs to heal from this pressure injury that she has. So I'm gonna recommend that she needs about 30 to 35 kcals a day, estimating about 1600 to 1900 kcals a day is what I would suggest for her to get her energy needs up. Um, and I'm also going to suggest that she needs protein because, of course, protein helps you to rebuild. Because she's severely malnourished, she's going to need that. She's had a bowel surgery. She needs wound healing. There's a bunch of inflammation going on that's stressing the system out. She has, again, this pressure injury. So I'm going to recommend the protein to be, between 53.6 kilograms a day, and estimated her needs would be 96 to 107 grams a day. So fluid is important, but of course we want to push the protein. But with fluid, I would suggest 30 to 35 kilograms a day, and 1600 to 1900 totaling out is what I would suggest, as well as formula. The formula that I would recommend that she use during her recovery period is going to be Vital 1.5 cal. And I'm going to recommend that they feed the Vital 1.5 cal through a tube feeding. And the reason why is because she's got to heal. We don't want anything going down orally right now with her on her own. So I would recommend a PEG tube and continuous pump feeding for her. The goal would be 55 mLs in 24 hours. Total volume would be 1320 mLs that I would recommend. And the nutrition, I would say 55 mLs an hour. The calories would need to be 1980 kcals a day, and the protein would need to be 89 grams a day. And free water, definitely free water, 1008 mLs a day, and flush to try to help her to meet her hydration, because that's definitely important. Um, so I would also recommend 150 mLs of free water flush every 4 hours. I would suggest every 4 hours, definitely. Totaling out to be like 900 mLs a day, that I would recommend personally. So my rationale for why I would want her to be on Vital 1.5 cals is because it's really a peptide base and it's easy to absorb. And right now she's in recovery, so we don't want anything that's too harsh on her. We want to start slow and easy. But we definitely want to get her off her proper nutrition that she needs because she has malabsorption and she's underweight. So we want to get her well. She underwent a major surgery, of course, and had a significant proportion of her bowel removed. So we want to get her the necessary help that she can to heal. Um, Basically, with vital peptide based protein, it's very easy on the bowel to digest and to absorb. So it has a lot of multi-chain triglycerides and MCTs, which again helps the patient absorb. And it deals with people who have like a compromised intestinal function. So this would be great for her. It's high calorie density. It's beneficial because again she needs to gain weight. She is going to have feeding issues for a while, so we want to assist her with recovery, her immune system recovery, and her bowel abduction as it heals. But we also want to preserve the lean body mass during her recovery period. So we need to have her on a high calorie, dense formula. Another thing that it will happen was that her duodenum was removed. So with the duodenum being removed, she lost a lot of functionality of her absorption. So she's gonna need some important things like iron, calcium, magnesium, sulfite, fat soluble vitamins she's going to need. And if she has that, that's going to get rid of or remove the risk of some things such as anemia, astopenia, all kind of vitamin deficiencies that would help with that, and electrolyte imbalances. Already, she's demonstrating by her labs that she has vitamin D deficiency and low albumin. And again, malnutrition was definitely shown in her markers and inflammation. So she has quite a few things going on that we need to look at. Also, with the jejunum, it's responsible for absorbing carbohydrates, proteins, fats, water soluble vitamins, and macronutrition. So all these things are important for the body function. If you lose those sections, then we have to figure out ways to try to replace that. Um, so the ileum was affected by the vitamin B12, bile salts, fat soluble vitamins. Loss of the ileum is going to be loss of vitamin B12, fat malabsorption, bowel acid, diarrhea. All these things are affected when you remove sections or any repairs on those sections are done. So with all these changes that has happened to her body, she's going to need a lot of nutritional help, a lot of nutritional support. So once she gets to a point where she's back to functioning, we definitely need to work with her so she can eat 5 to 6 meals daily, and avoid large meals because that would, of course, cause dumping or diarrhea. So we want to encourage her to do high protein meals, which consist of tofu, soy, milk, being that she's a vegan, so beans, lentils, pea proteins, vegan protein supplements. Of course, hydrate. We want her to sip fluids, take vitamins, so the vitamin B12, vitamin D. We want her to take iron, calcium, all those things in order to support her healing. Magnesium, zinc, multivitamins. And we want to get her to monitor her stool output. We want to make sure she's absorbing everything properly dehydrated. We don't want to have a repeat bowel obstruction. Also, we want to make sure this pressure wound that she has is healing by giving her these proper nutrition tools. We want to track the food as we introduce this way of eating to make sure there's no cramping, there's no diarrhea, there's no bloat, there's no abdominal pain as we begin to feed her. And of course, exposed to vitamin D and sunlight, of course, would also help. My last thing that I want to say, this is my PS statement or PET statement: severe protein, calorie malnutrition related to malabsorption, secondary to extensive bowel resections, impaired digestion and absorption, chronic Crohn's disease, and increased metabolic demands from infection, surgery, and wound healing, as evidenced by BMI of 17.4 kilograms. She had 16 pounds of unintentional weight loss, poor oral intake, albumin level of 1.8, GDL, severe muscle wasting, need for TPN, and internal nutrition support at stage 3 pressure injury. So Elsie will need some help in her recovery. So I hope you enjoyed this presentation, and this was most informational. Thank you.